Muy buenas tardes y les damos ahora sí la bienvenida al foro comunitario sobre el acceso a la atención médica de Cencal para nuestra comunidad aquí del condado de Santa Bárbara. Realmente es un honor ser parte de este panel y gracias a todos nuestros panelistas que hoy están aquí. Y qué manera de entender a nuestra comunidad latina que estando con la comunidad, como yo digo, vayan al trabajo del campo, vayan al campo, eso es lo más importante para conocer en realidad a nuestra comunidad latina. Recuerden que servir y ayudar es una meta valiosa que tiene un impacto positivo en la vida de las personas. Sé que son tiempos difíciles, pero lo que les digo es que no perdamos esa identidad, ese idioma. Siéntanse orgullosos de hablar su idioma, de portar sus raíces, su cultura, de hablar español y mixteco. Nunca dejen que nadie les diga que son menos, ¿verdad? Estamos aquí juntos en comunidad y por primera vez en muchos años que yo llevo haciendo un trabajo voluntario, nunca habíamos podido conseguir estos grandes panelistas con una buena información, así que démosles el aplauso. Y para mí es un honor presentar a Sandy Close, que viene desde San Francisco con el medio de comunicación más importante de todo Estados Unidos, American Community Media. Ella es una eminencia, es una persona que por 35 años ha hecho esta clase de eventos y ha alzado la voz por la minoría como nosotros, que nos ven pequeños, que somos grandes en espíritu y en corazón. Así que para mí es un honor tener aquí a Sandy Close, que es una eminencia.
I apologize, I don't speak Spanish, and I am so glad to have our interpreters here with Spanish and Mixteco. We hope that if you have questions, you will raise your hand after our speaker finishes, and we will come and ask you your question and make sure that our panel can respond. This is a wonderful event that is organized by the Department of Health Care Services, which runs Medi-Cal. And they want to be on the ground with community. This is what inspires us as journalists to want to work with them. And the people who come from the county are similar. They want to be here to answer your questions. So with that, at a time of fear, uncertainty, misinformation, we hope to address some of your concerns about access to healthcare. And we begin with our first speaker, who represents the Department of Health Care Services. I'm going to let her introduce herself. She is going to give you an overview of what is happening around Medi-Cal. So with that, I introduce you to Yingjia Huang, who came here from Sacramento to be with us tonight. Yingjia, thank you.
Thank you, Sandy. How's everyone doing tonight? Good? I'm very excited to see all of you. My name is Yingjia. Just doing a mic check. Can you hear me okay? Fantastic. So my name is Yingjia. I work for the Department of Healthcare Services up in Sacramento, which Department of Healthcare Services, you probably may not know who it is, what the organization is. It's a state agency. We administer the program, the Medi-Cal program. Many of you probably know it's the program where you go and get health insurance, and it's a white card with a poppy flower, and it's a very important program. We cover, the Medi-Cal program covers 1 of every 3 Californians, and so we know it's so important to be here, and so a really big thank you to the community for having us here tonight. As Sandy was sharing, I'm here from Sacramento, so I had a very eventful day. I actually flew down to Burbank and drove up here. You're probably like, well, you could probably make it coming faster if you just drove down from Sacramento. Well, good, that's how you learn, next time I know. So I'm very happy to be in Santa Maria today, and big thank you to all of you. We really want to have this opportunity to have a direct conversation with the community here. Healthcare services know as the program administrators of Medi-Cal. There's a lot of changes going on. You hear it in the news, whether it be the local news, the federal news. But I want to be here just to tell you that the Medi-Cal program, even though there are changes coming up, I want you to know Medi-Cal is not going away. We are here to continue to provide health care to all of you. And remember, health care under Medi-Cal still covers preventative care, dental, vision, medications at the pharmacy. And also sometimes even now, we just released a new benefit called transitional rent, where under our managed care plans, my partners here will later share a little bit more about that, where it will help you with a rental assistance in terms of the dollars you need to actually pay rent and be sustainable. And just wanting you to know that the program itself, even though there's so many changes under the federal administration right now, the program is still here to support you. Remember, Medi-Cal, it has an annual renewal process. Many of you might remember every year you get a packet from the Medi-Cal program. This probably comes from Santa Barbara County, since you're in Santa Maria. Or if you are the neighboring counties, maybe San Luis Obispo County, it comes in a double envelope. And it tells you must renew your coverage every year. We want you to make sure that you're still doing that. That is so important to keep your Medi-Cal. In 2026, there's some changes that I want to just highlight for you. Again, the program itself isn't going away. There are some changes. So beginning early this year, January 1st of 26, Medi-Cal froze enrollment for a subset of individuals. And it's individuals without documentation status. However, if you were already in the program prior to January 1st of 2026, which is this year, you're still what we call grandfathered into the program. You will still have the full breadth of the Medi-Cal services that's offered to you. If you apply after January 1st of this year, if you're pregnant, if you're a former foster child, if you're a child under the age of 19, you will still get the full breadth of Medi-Cal services. When I talk about the full breadth of what that means, it means you'll still get your preventative care. You can still see your family doctor, your vision, prescriptions, mental health, substance disorders, and all the type of kind of preventive care that you can also get under kind of the normal circumstances. Also, this year, there also is another change that's very specific to our individuals that are age 65 and older, and maybe disabled. Medi-Cal is bringing back what we call assets. In the Medi-Cal program, you definitely know this, hopefully, that you can have one house, one car, and that's okay. We don't count that as part of the Medi-Cal determination. You can own that, no concerns. However, beginning January 1st of this year, when I say assets, you can have up to $130,000 in assets, and that assets is bank accounts and things that you own that's more than that one house, so maybe a rental home, for example. Just want to say California has a very high, kind of 130,000 asset threshold, but we are bringing that back, and we will be reviewing those documentation as part of your annual redetermination, which is once every year. And lastly, also wanting to share that there is a subgroup of Medi-Cal population where beginning July 1st of 2027, there will be a $30 premium. Remember, your Medi-Cal isn't going away. It's only going to be for a subgroup of all the Medi-Cal populations that are receiving coverage. And that is next year, so I just want you to know that that's coming. But we will have the noticing and just to make sure we're informing you of those changes. Department of Healthcare Services know, like, in order for us to make sure that we're spreading the word, we're doing these types of events to make sure we're connecting with you on the ground, letting you know and sharing that these changes are coming. It will be impactful, but the program itself isn't going away. But there will be some changes that you need to know about and to make decisions. Also, we're going to start texting individuals. So if you have your phone number when you are applying for Medi-Cal, we have started texting individuals in the community about these changes. So you may have actually received a text message from the Department of Healthcare Services about these changes. So really wanting to reassure you though, continue to make sure you're returning your yellow packets in the mail when it's coming to you. And also, lastly, don't be afraid to apply. We want to make sure that you get the care that you deserve. So please continue on applying and making sure the paperwork is in place, the renewal packets, the yellow packets you guys are receiving in the mail is coming back to the county, reviewing the text messages that we sent you. We're here to help you, and my colleagues here will share some additional information. But we're not going away, so I really want to make sure folks here, if there's only one thing you take away besides the burritos and the new friends that you're making at your table, just know the program is not going away. The program is here to stay, but there are changes, and we're committed to making sure you understand what those are this year and next year.
Thank you. I would like for our reporters and our community attendees to raise your hand. We have time for 2 or 3 questions. We will take more questions at the end of the panel. But who has a question now? If you could raise your hand. Yes, you have a question. You have to speak in English.
¿Qué pasa con las mujeres que están en estado de embarazo y acaban de llegar al país? Ellas tienen la oportunidad de recibir toda la atención médica.
What happens to people who come here pregnant, who have just arrived in the country pregnant, and they access health care?
So, pregnant individuals are exempt from any of these changes in Medi-Cal, and if you need care and you're pregnant, there are a couple of options. We have hospital presumptive eligibility if that's needed. We have a program just for pregnant women, meaning that it's a short application and you'll get immediate care. And then they will also have to, once they get immediate care for all prenatal, pregnancy-related services, they can also apply for the long-term Medi-Cal, which is the full application. So all to say is pregnant individuals who come to this country have immediate access to health care. And that's not going away.
Hello.
So if you apply for presumptive eligibility for pregnant women, which is a Medi-Cal, a version of the Medi-Cal program, it's regardless of your immigration status. So it's very important and this is the name of the program, it's called Presumptive Eligibility for Pregnant Individuals. And very short application, they fill it out at the doctor's office, and immediately they'll get the prenatal and any pregnancy-related care that's necessary to support the pregnancy.
Hello, this is Griselda a daily newspaper in Los Angeles, talking with different families. They told me that they are very afraid that they can lose Medicare, the changes. Can you explain us what is the situation with Medical, which persons continue to lose? And also they told me that it's very hard to apply for medical or to renew the program. Even it's hard for people that can speak Spanish or are bilingual, but especially for those that speak, like for example, Mixteco or Zapoteco. So is the program doing something to make the process easier? Thank you.
Thank you. My apologies, I wasn't able to get the first half of your question, but I caught the second half about further supporting different languages. So we are actually investing, and this is pending the legislature's approval, for additional navigators on the ground to support families. Because, we know language barriers is a real issue. And so the idea is that department, with some healthcare philanthropy, will be partnering to actually implement what we call Clinic Navigators program, where they actually will have navigators who can speak the languages in the community, and they will be kind of physically present and meeting the member of the individual where they are at the point of care to help them fill out the application, fill out the renewal paperwork, etc. So we are definitely thinking about that, understanding that we may have some limitations right now, but right now we do have a $4 million kind of budget request in this year, pending the approval of the legislature, so that we could actually start this program. So I think in general, the question is, what would we share from the department's perspective about people who are afraid to apply? As I shared before in my earlier remarks, I think it's, don't be afraid. We are still telling folks in the community, spreading the word that people need to and should continue applying. Because it really is, healthcare is your right, and you need to have that access to care, and this is why we are doing these forums. We are kind of thinking about different pathways to encourage that, and there's ideas in the community to kind of provide that reassurance. We can absolutely do that. This is why Department of Healthcare Services is here to actually provide that word of reassurance to you. Please do not be afraid. Please continue applying.
Okay, thank you so much. One more question. This is Jorge Reyes from Emerita. One question from the community that we've heard is about medical that if a person is to be working, will there be working requirements in order to receive medical?
That's a great question. So the question is about whether the work requirements, which you guys probably have heard in the news, will be applicable to these populations. So maybe a little background about what that is. So this policy is a federal policy that became law in July of last year, where beginning January 1st of 2027, if your age is if you're between the age of 19 through 64, you're maybe under 138% of the federal poverty level. You're like, what the heck is 138%? I have that. So if you're a single person and you're making $1,836 a month, if you're making below that, and you are not providing care for a child that is 14 and under, you may have to actually be subject, meaning that these work requirements may apply to you. And what does that mean is every month you will have to prove you're either making $580 a month, and that's counted by the federal minimum wage, or you're out there performing 80 hours of community service, or you're a half-time student / full-time student, depending on what you are, or there's a bunch of other exemptions. If you're pregnant, it doesn't apply to you. If you're a former foster care child, it doesn't apply to you. If you're a child under the age of 19, it does not apply to you. Right now, where we are, we're still working through the policy guidance. It is a federal policy that California, and unfortunately, all states have to follow because it's federal law. It will be effective January 1st of 2027. So what I can say is, we will do what we need to do in California to make sure that we are reducing the amount of people that actually that are subject to this policy. So there's a bunch of data sources out there where we could use your information to verify whether you are already exempt or you are already compliant. So we are going to maximize everything we can as government to use all the sources and information available to us so that we will not have to ask you to fill out additional paperwork or actually go and actually meet these work requirements. So prior to that though, we will make sure we will communicate that to all of you through notices, through text messaging, to make sure you know what those requirements are. But really wanting to stress that it should not be a barrier to you to be afraid to apply for Medi-Cal. Medi-Cal is still here. What I just shared doesn't change with the work requirements. And so just really wanting to stress whatever we do at the state level, as we're rolling this out in the next 10 months, you will be notified. Noticing will come in the language that you prefer, and so that you will actually have adequate notice before you make any decisions.
Thank you, Yingjia. We can go back to the questions. We just have to go to our next speaker, but if we have one more question, okay, please. Okay, thank you.
Good afternoon. They just took away Medi-Cal from me. Permítame. No se le escucha el micrófono.
So, can one of you translate? Roxanne, do you want to?
Buenas tardes. Quiero preguntar cuánto es el tope para ganar, para poder aplicar legal, porque yo.
How much is the cap to apply for Medi-Cal? They just took Medi-Cal away from me. I have a student that's 20 years old. She depends on me, and they took her Medi-Cal away as well. She's still a student. I want to know what's the cap so they could take away Medi-Cal. Thank you.
He wants to know how much he needs to earn in order to qualify for Medical, because he has dependents and his dependent has lost Medical too. So he wants to know about that.
So what I'm going to do, it depends on your household. So what I'm going to do, I'm going to give you my card, and let's connect. Because there's some circumstances that is different for every family. So we can talk.
So please, Yingjia, you could go from the panel now and just respond, because this is what we so value, questions from the community. Thank you. Our next speaker is now speaking from Cencal, that healthcare plan that covers Santa Maria and the whole of Santa Barbara. And we welcome and are appreciative of Jordan for their time this evening. Jordan Turetsky, you're on. Maybe you want to use this.
I think I might want to. There we go. Thank you, Sandy. Good evening. It's so nice to be here with all of you tonight. I want to start by introducing myself and my colleagues. Sandy said my name is Jordan Turetsky. I'm the Chief Strategic Engagement Officer at Cencal Health. I'm joined by my colleague,
Elia Rodríguez, soy la directora asociada de servicios para miembros con la organización de Cencal.
and I'm also joined by several colleagues at the table in the front. Dr. Vondo Reynoso is our Chief Customer Experience Officer. Sarah McDonald is one of our board members. Lisa Bravo is the Chief Executive Officer at Family Service Agency of Santa Barbara County. FSA has a booth in the back, and Cencal Health has a booth in the back. So please feel free to connect with any of my colleagues, either here at this table or in the back. Okay. Do we have slides, Sandy, or should I just talk? Okay, I'm just going to start talking, if that works. Okay, perfect. So, we heard from my colleague at the Department of Healthcare Services that in California, the National Medicaid program is known as Medi-Cal. If you qualify for and have a Medi-Cal in Santa Barbara or San Luis Obispo County, Cencal Health is your health insurance plan. We don't determine your eligibility, we don't enroll you, but we provide access to services through the Medi-Cal program. Our mission is to improve the health and well-being of the communities we serve by providing access to high-quality health services, along with education and outreach for our members. And we're guided every day by our values, which are integrity, compassionate service, collaboration, and improvement. We've been serving Santa Barbara County for 43 years. We're actually the oldest health plan of our kind in the country, and it's an honor to be here and to be doing this work with all of you. Right now, we serve around 238,000 residents of both of our counties. Approximately 172,000 of whom live in Santa Barbara. For context, that's 1 in 3 residents of Santa Barbara County and 1 in 4 residents of San Luis Obispo County. The Medi-Cal program provides a variety of benefits to those who are enrolled, and to discuss those benefits, I'm going to hand the mic to Elliot.
Muy buenas noches.
Buenas noches, Eli.
De estar aquí con todos ustedes.
An honor and a pleasure to be here with you guys this evening.
Mi nombre es Elia Rodríguez.
Eli Rodriguez. I'm the Director Associate with Member Services, Cencal Health. I've been with them for 21 years. The services available are primary care, special care, sensitive special care, people to go to the hospital, emergency services. We have attention for mental health, services of transportation for your doctor visits and return to your home. We have services of laboratories, medications through Medi-Cal RX, and services of interpreting and translation. And those services we have also available to our members are deposits of living places. If they need to relocate, if they're in danger of losing their home or their rentals, that we're here available to be able to answer your questions. We also have consultations through telehealth, and that's the member that we offer our members, and also a Cencal Health 24-hour nurse, 24 hours, 7 days a week. If you don't need to go to the hospital or to emergency room, you could call this number, and there's a nurse that's going to answer in your language and to answer your questions. See what's going on. Other services that are available through our department, to our members, They can help you with any questions that you guys have. Our hours are from Monday through Friday from 8 a.m. to 5 p.m. You could call the number practically that we have, and your services, also extensional benefits that we can help you with. What other services or what other options have, how we can help you, and trying to find a doctor for you, a specialist. If you have questions about their benefits, please ask us. Communicate with Cencal to see how we could help you. If someone is asking and sending you a bill, we can help about those with those as well. You can also submit a complaint, or if you could appeal a service that was given to you, we do all the paperwork, so you guys don't have to do it. We're here for you. Services of transportation, services of interpreting services. We also need to go see a specialist. Sometimes the doctor says, you have a certain specialist. We could help them with those referrals and ask and work with you. In our table we have here at Cencal Health, we brought information and also available ones that are right here for all of you, if you guys like to. That's how our conclusion ends today, and we could be with everybody. Thank you so much. Thank you.
I'd love to take 2 or 3 questions. And honestly, I welcome the journalists here because you know how to ask questions. But I also welcome community attendees. The questions are about the healthcare plan that probably serves most of us in this room.
I have a question. Sorry. This microphone is really loud. Okay, so my name is Brenda Garcia. I'm a provider, so I appreciate Cencal. I'm a provider under you for mental health services. And so, Jordan, thank you so much for your information, and that's exactly the reason I'm here. So, I can't identify my clients, but half of them are undocumented. And I do know that last year, some of us failed a Zoom meeting, and some of the people here went to Santa Barbara County district meeting where we talked to our board of supervisors because public health wanted to transfer 7,000 patients last year. Right? Microwave. So because we filled Santa Barbara County district supervisors, and they made a decision to not transfer these 7,000 patients immediately. And then there were other agenda items. However, with what you're saying, and they wanted to jump the gun, right? Public health wanted to jump the gun because they knew the big beautiful bill was coming and all this stuff, which is fine, right? And that started educating us, especially myself as a provider. I'm here to get educated because what do I tell clients come first, right? Received a letter, so I to these meetings because Claudia has, very good at getting us together to find out the answers to be able to provide the service. So that is what I tell clients who are, now something's gonna happen July 1st, 2027. But from here until July 1st, 2027, what do we tell them?
Just asking very quickly to summarize key questions, because it is very important information. What is the question you would like Jordan to address?
Set out. Is there a transition plan? Is there no transition plan? Is there, hey, we need to transfer X amount of cases that you currently have? Or hey, there's going to be this new program being offered. people that still need, access to cancer care, for example. I can't even imagine what's going to happen to cancer care patients.
And also, we can ask our speaker to come and follow up directly with you because you are a provider and you have these very important questions.
So thank you very much for the question. I know that our county partners are here. I certainly do not want to speak on their behalf. What I will share is that if you are a Cencal Health member, you have access to a primary care provider assigned to you. You have access to specialty care services, to mental health services. If your provider changes, we will make sure that you have a new provider to take care of you. So I hope that answers your question. If you have a specific question for my county colleagues, I know that they're on the panel, and I'm sure they'll be happy to address any questions that you have.
And Jordan, after the panel, if you have questions, would you come up and ask Jordan and Elia so you get a chance to follow up? Okay. Any other question for Jordan? Nestor Fantini.
Hola. Yes, Nestor Fantini from HispanicLA.com. And I was talking to people from the community-based organizations, and they told me something that really surprised me. That during the pandemic, apparently a lot of the workers felt kind of encouraged to use technology. And they actually mastered it. So, I don't know if you're familiar, but with the Bill 338, Senate Bill 338, that's the hub for rural because what they were telling me is that they do communicate with some of their clients through computers and smartphones. So, are you familiar with SB 388? And do you know the status of that law? Now it's actually a law, and I think that they were looking for, I don't know how many million dollars to actually promote the initiative.
And if you're not, we can follow up with Nestor, because this is a chance for us to find out what we don't know. And we often don't know what we don't know. So it's very helpful.
I cannot speak to the status of that bill. I can say that our members have access to information through our member portal. My colleague at the Department of Healthcare Services also spoke to text messaging that's about to be rolled out, and so hopefully that addresses some of your question. We're happy to follow it up.
Great. And we have time for one more question. Roxy from the community. Yes. Technology often doesn't work as well as we hope. Bueno. Roxy, why don't you get her question and repeat it?
Y estoy hablando por todos mis compañeros del campo. Yo trabajo en la fresa y hay muchas personas que no tienen medical ni Cencal. ¿Qué se necesita para poder tener medical y quiénes son las?
What is needed to have Cencal? And I work out in the strawberry fields. I pick strawberries, me and my coworkers. What's needed to go apply and to qualify for Medi-Cal? What's needed now?
Many of them don't have medical or Cencal, so she wants to know what do they need in order to qualify for those benefits.
Very, very good question. Under going to ask Yingjia to answer and also ask Elia to answer.
So in order for you to qualify, it's actually an application you could do online, benefitscal.com. You could go online and apply, or you could call the county, that's also an option. You could also go to the lobby and do a walk-in application. So there's a couple of modalities for you to go and apply and get your coverage. Once you become eligible, the counties have 45 days to make a determination. And oftentimes it's faster now with a lot of the new changes that has happened. And once you are eligible, what happens is then Cencal there will be like a choice packet that will be sent to you to choose a plan. So you won't even need to choose, it will be Cencal in terms of them providing the information to you. But the first step is filling out the Medi-Cal application. And you could do that online on the phone, or also if you would like to do a walk-in to the county as well.
A walk-in where? Where?
A walk-in to the county social services office.
I've got it. Okay. You have two more questions from the community.
Someone wants to know if those people receiving services from Cencal are still going to receive dentist coverage.
Very, very good question.
So beginning on July 1st of 2026, there are certain Medi-Cal populations that will no longer receive dental services. And it's specific to certain populations with certain immigration statuses. So your Cencal won't be impacted because if you are in Santa Barbara County, you have what we call Medi-Cal dental fee for service. So it's separate and apart. Your Cencal won't be impacted. But again, if you have certain populations with certain immigration statuses, beginning on July 1st of 2026, dental coverage will no longer be covered under Medi-Cal. However, if you are pregnant or if you're a child that's 19 and under, that will not impact you. Or if you're a former foster youth or a foster care child, you will not be impacted. You will continue to keep your dental coverage.
Okay, and last question before our next speaker.
Someone is asking if the rent assistance program covers deposit for homeless people in order to pay those deposits to get a place.
Could you repeat the question? Because I think it's hard for this room to hear.
So, la pregunta hicieron...
The question that was asked, it's about the deposits for renting, right? For a home rental. As I mentioned, there's certain criteria. They're members of Cencal Health. There is a service, and it is available. But like I said, there's certain criteria that you have to comply with. And if you have more questions, call us, and we can see what can be done to help you guys with that. The question is specifically for homeless people that are out in the street. Our services are also available for those people. We have certain teams. They don't have a home, and we'll help them find a home. Elia, how quickly is it for them to get help for rent? Because we did talk about certain criteria, very specific one. We have Cencal available that specialize in that. For those with the criteria that they have, they can help by calling the number. We speak Spanish as well, with more detail, and connect you with them more so they can help you.
We're going to go to our last three speakers so that we have plenty of time at 6:30 for people to come and ask individual questions. But because we have Radio Indigena here, I want to make sure, do you have any question before we move on?
Thank you. Yes, of course. Another question from the community besides in regards to medical, but about food services like CalFresh. You know, people that also depend on medical and also depend on CalFresh. What are the new updates for CalFresh?
Okay, thank you. That is a perfect segue to, I think I'll go to Dario next, and then Dario Ferdazzi is with the Department of Social Services. And thank you so much for being here tonight, Dario.
Thank you for having me. I'm grateful to be here. So, what is the question exactly?
CalFresh. The question is really about CalFresh.
Yeah.
What's happening to those kind of services?
Yeah, so we still have CalFresh in the community. That is not going away. Actually, we have a table over here with CalFresh information on how to apply for CalFresh. Some of the major changes that we have coming up in the program, effective April 2026, those who are non-citizen and qualify for CalFresh is going to change. So there's a new definition of non-citizens who can qualify for CalFresh benefits. And then effective June 2026, we're also going to have work requirements in the CalFresh program. So there are changes also coming up in CalFresh when it comes to who is a non-citizen can qualify for CalFresh, and also work requirements that will be implemented in June 2026. And the way that one of our goals and objectives is to make sure that the community is informed and they're aware of these changes so they can make an informed decision. So one of the things that I do recommend is that everybody follows the website. That's where we post our changes. We also have social media accounts where we share information. And you can also sign up with benefitscal.com to receive text message updates. So these are changes coming up in CalFresh. We are still receiving guidance from the state. We are still drafting policies for our staff. And the best way to stay up to date with these changes is to follow our website, follow our social media, and sign up for text messages.
Thank you. And please share with us, before I sort of started you in with the question, what is your sense of the most important services the department oversees and who qualifies and what changes? I mean, I think what people want to know is what's happening now, and just as you said, what could happen in the future.
So just in general, when it comes to social services?
To the programs you administer. I'm sorry, the programs that the Department of Social Services.
Yeah, so social services, we offer a diverse and wide range of services. We offer Medi-Cal, which we just heard about. We also offer CalFresh, which is food assistance. We also have CalWorks, which is our cash aid for families. Within CalWorks, we have Welfare to Work, which is employment training and education for those who participate in the CalWorks program. We also have homeless assistance for those families. We also have a general relief program, which is cash assistance, usually for individuals who are single and don't have a child at home. So we have a lot of services and programs that we offer to the community. Is that the question? I hope I'm answering the question.
And yes, what are you most concerned about, Mr. Ferdazzi, in terms of the people who've come tonight, that they need to know they can access now. Maybe as of June, no longer, but the focus is now. What are the most important services people need to know they can access now?
Yeah, so I think DHCS made a great point when they say that we're still here, even though our programs are going through changes, even though we still have a lot of guidance and direction that is pending, so we might not have all the answers. I guess the message is if you need the assistance, if you need help, please contact the county. You can contact us via phone. You can walk into our offices. We have 2 offices here, and we are here to inform. We are here to help you as you try to access essential benefits.
Thank you. I'm going to ask Michaela Killer Westall now to follow from County Health, because this is really where the services, I'm going to give you my microphone, maybe it's better.
Thank you. First of all, I'm delighted to be here this evening, and it's a real honor to be invited and to be... Sorry about that. And I would also like to take the opportunity to introduce County Health, formerly known as the Santa Barbara County Public Health Department. And with me this evening we have Paula Rentano, our Division Chief of Primary Care Federal Health, joined by Ryan Schumacher, our Chief Information Officer, and Dr. Preciado, who's our Chief Medical Officer. And our representation at the table is also Melgoza, and Avana, who's been so helpful to set this up, and we're all available afterwards to also help answer questions. I just want to let you know that this event is very near and dear to my heart. I've lived here now for 21 years. I moved here when my son was a week old. And I've been with the health department for 17 years, mainly in Lompoc. I'm the health center administrator now, both for Lompoc and Santa Maria. And for the county health department, what I think a lot of folks might not be aware of, that we actually have 5 health centers in Santa Barbara County. There's 3 in the South County, Santa Barbara, Franklin, and Carpinteria. And then for North County, we have Lompoc and Santa Maria. And we provide you with your own doctor who knows you and your family. And that is so important. And the preventative care, especially right now, that's what's really the priority for all of us. We don't want you, or you should not want to wait until you're sick or you have to go to the hospital. We want to take care of you now for prevention. I think that's I don't know how to say it in Spanish, but it's, I think, a famous saying all over the world. An ounce of prevention is better than a pound of cure. And I think that's, so true nowadays. And that's, we take care of your short-term illness, long-term disease, and give advice to help you stay healthy. We also help coordinate your care across multiple settings, and also really want to thank our partner Cencal to help us navigate the system and our patients. So it's a true partnership. We provide, everything really. It's family practice, pediatric care, immunizations, urgent care, same-day visits, behavioral health, medication-assisted treatment for substance use, and also I'm really proud to say, between Lompoc and Santa Maria, we offer a full range of women's health services, including OB services. And just like we were earlier with Medical, there are really no significant changes. It's all about the prevention. So also, especially afterwards, please see us at our table, give us your information, we'll reach out to you or call our health centers, and we'd be glad to give you more information and schedule your appointment. In addition to our family practice, we also offer ancillary services. So we have registered dietitians, lactation consultants, home visits for babies and mothers through our MCH department. And we also have care hub service navigators that help you navigate the system, because we all know it's very complex, but there is help for you. And so we also, everybody, we're not an island. I think we all rely on each other, and I think we at our health department, we really pride ourselves to be connected to so many services. One of the things that we started, thanks to our director, Muhammad Amani, we actually enjoy a great partnership with the Santa Barbara County Food Bank. And so we have monthly distributions both in Santa Maria and in Longport. In Santa Maria, it's on the second Tuesday. I always get confused. Santa Maria is the second Wednesday of every month from 2 to 4 p.m. So we just had our distribution yesterday afternoon, and it's right in front of the health center, right where social services, probation, the government offices are. Anybody can come, so please, take advantage of it. And while you're at the food bank, stop at the health center and find out how we can help you, all the services that we provide. Same in Longport, it's on the third Tuesday of every month from 2 to 4 p.m. So really want to invite everybody to, take advantage, of the services. As far as the coverage goes, I think we already got a lot of information from our partners, but I think the key for our department is nobody will be turned away. You do not need to have Medi-Cal, any coverage. If you are a self-pay patient, we offer a sliding scale. We really work with you. For women's health services, we also work with the state program of the Family Pact, as well as Every Woman Counts, and it is my understanding they're also represented here tonight. Again, there's so much information. I think it's almost sometimes overwhelming, but please don't hesitate to check in with us, and we'll have you navigate. That's all in Spanish here, so I think we covered that. And then I hope that most of you are familiar with our locations. But the Santa Maria address is the 2115 South Center Point Parkway, and it's really the government building where you have our social services, probation, DSS. I think everybody knows where that is. And Longport also, we share the campus with social services. We're right in the community on 301 North R Street, and I really hope to see you there. Thank you so much.
Thank you. I think that I'm going to ask a question of Javier. Do you have a question here? Great. Okay. Can you stand up?
I want to reiterate people's questions because I don't think it was answered. Just simply, what can get you rejected from Medi-Cal? What would get you disqualified for being accepted for Medi-Cal? I think that's why people are scared to apply, because they're nervous of getting rejected. So what does it take to get rejected from Medi-Cal?
So a couple things where you may deny for Medi-Cal coverage. The reason usually is because of income. You exceed the income threshold. So say you are a family size of 4. Every year there is what we call an update to the federal poverty level, which is a dollar amount. Every year it changes slightly, and it's tied to like inflation and things like that. So depending on how you file your taxes, who lives in your household,
the income level may change. The dollar amount is usually what will disqualify you. This is oftentimes what we do see. In California, regardless of your immigration status, even though there has been some changes, even though if, say, you are an individual without documentation status, but you meet the income threshold for Medi-Cal, you still get emergency services, you still get pregnancy-related services through the 365 days, that 1 year postpartum period, you get kind of the full breadth of benefits. So usually, if you are under the age of 65, it's usually your income. I talked a little bit in my presentation about assets. So if you are 65 and older, and you do have assets, if you have a second home potentially, like a second home, a second car, and depending on the money you have in your bank accounts, if it exceeds $130,000, then you may potentially be disqualified from Medi-Cal. And one last thing that may disqualify you is if you don't return your paperwork. That is also the most important thing. If you get something from the county asking you to provide additional information, make sure you return it. Or if you're moving, make sure you're updating your address with the county, or else if we can't find you, there is a possibility we will have to disenroll you or basically move you off the program because we can't actually get the information back because we're sending it to the wrong address. So those are usually the reasons that we see where it may potentially be disqualified.
Thank you. And one, yes, a question.
I have a question in English, please, if I may, please. Well, all of these agencies are asking information about the applicants. And it doesn't matter if it's county, city. And we also know that today the immigration is using all this information that they can to go and arrest these people. Well, then what can you say to the applicants, to the people that need the services in regards to their security and if they're not going to fall into the hands of immigration, of ICE, and that information that they're supplying to you?
You know, all of the agencies here, state and county agencies, are asking people for information as part of the application process. We know now that Yingjia is using information from everywhere that it can get to identify people who come up before them. So what can we say to people about security of the information that they are providing, that it's not going to wind up in the hands of immigration enforcement of these locations?
Yeah, thank you for your question. And I think what we can say is, at the state level, if you apply for Medi-Cal, and this is pre the current Trump administration, these are federal rules, where if you are on the Medi-Cal program, because this is a federal and state program, the Medi-Cal program, we have to share certain information with the federal government. Now, what I can say currently is we're still here, the program is still open, and we're reassuring you that if you need the care, you should still apply. Now, that is your decision. The program is not going away. And from a federal perspective, the data is with the Centers for Medicare and Medicaid Services, which is our federal control agency. And I cannot speak to the fact that whether they're going to turn it over to Department of Homeland Security or not. That is ongoing. There's an ongoing lawsuit at the federal level that I cannot speak to. But what I can say is at the state level, we are very committed at the Department of Healthcare Services to respecting that privacy and protecting that. And that's why I'm here today, because I know there's that fear in the community about this, but our doors are still open and we want you to get the care that you deserve. But we know ultimately that is your decision.
But really being here to share with you that the program isn't going away, that those services are still available if you still choose to apply.
Thank you. We're now going, Roxy, one more question. I want to go to our last speaker as soon as possible.
Okay, a couple in the audience was asking if they are not married, but they have a child together, if they still qualify for CalWorks, because they have been told that they do not qualify.
Because I'm not CalWorks, we will probably have to take this information back. Maybe the county can take and review the information. If we could get the information, if the person doesn't mind, the family doesn't mind sharing this information, I'm sure the county can assist.
Who in the county would we take that question? Dario, great, thank you.
Yeah, so we have two staff over here from social services that are available to answer any questions, or they can approach me as well.
That's terrific. Our last speaker is now going to raise the concerns of the community with which he works. He is president of the Nijtec Parents Association working with Santa Maria School District. And we would love to ask you, Francisco, what concerns do you think are most important to people around the access to health care that we discussed? And if there is someone you would prefer to speak in Spanish or Mixteco, and if there's somebody who could translate to English, please go ahead. Thank you, and thank you for being here.
Bueno, buenas noches a todos. Culturalmente, comunidad mixtecos.
Hablando en español. Good evening to everyone. And also in Mixteco, we don't give the welcome, we give our act of presence, and we appreciate everyone for your presence. Thank you, members of the community. Thank you, as well as the authority figures also from different departments of health, given locally and also statewide. And thank everybody, all the people here from the media that are here tonight. Thank you so much for your presence. And my name is Francisco Lozano, member of community of the Mixteco community, president of the Mixteco parents and their advisory board, working with also with the local school districts and also La Bonita and also the high school level. We're talking about close to 25 schools through both of the districts, and also as a founder of that movement of the project of Mixteco Parents. It's getting parents involved in the process of the school process and academically with their children in school to maintain their language, native tongue, to also, they don't forget about their origins, where they come from, the Mixteco indigenous language. This is our purpose that we started with that project. But also as parents, that we don't dominate the Spanish, we can't dominate English. We don't want our children to have that same barriers. And so today, this evening, I want to share what the barriers have been and also the things that we are confronting now as a Mixteco community. We don't need to victimize ourselves, but the reality of what we're confronting is real. And right now when we're hearing the presenters to go to the web pages, go get information, obtain information, to be able to fill out the applications. Really, for us as a Mixteco people, this is impossible. A lot of people don't know how to read or write. They can't dominate even a language. How are they going to go into and obtain that information? So that's the barrier, linguistic, and also how to obtain that information in a technical field. We're talking about changes that are going to take place. How are we going to obtain that information in our own language? We're not talking about only one Mixteco community. We're talking about hundreds and hundreds of communities of Mixteco from Oaxaca and Guerrero. There's a lot. There's many variants of the language as well. So how can we obtain that information? Many times, the information is in English, and then it changes over to Spanish, and then it gets translated verbally into Mixteco. The information, it's not going to arrive equally anymore. You could add to it, or maybe it's going to be lacking.
If you could summarize for those like myself don't speak Spanish, just the key points, and then we'll go back, Francisco, to your final points. But I don't want to lose what you said.
So what I gather from those remarks is that he works with school districts in the area to serve the Mixteco community. And one of the goals and objectives is to make sure that the Mixteco language stays alive and children know how to speak it, so that communication remains with the parents and others. And then he also talked about some of the specific challenges in that community, such as lack of access to technology, and that makes it difficult for them to stay up to date with some of the latest updates, changes in programs.
Including health care.
Yeah, including healthcare and other changes that might be taking place in the community, and also the ability to read or write sometimes is considered.
Could I ask Francisco what you think the biggest concern is with Mixtec residents around healthcare access? What are you seeing, especially for parents with children? Are they taking children for health checkups, or are they worried about getting stopped?
Oh, may you repeat the question again, please? The concern is the changes that we're talking about is maybe because of their income, they're afraid of losing those benefits. Because as I said, there's no other way of obtaining that information in their native tongue. Just like this evening, we have a lot of information. How do we to be able to obtain that information so they can also, they don't have concerns or worries? As they were saying, I have a history, I have a story to tell about a family. They could not go over $1,800 to qualify, but they make $4,000 a month and pays $3,000 of rent, and $1,000 is left over to pay for their food, their gasoline, and other bills that they're responsible for. So there's no money left over. And even then, he didn't qualify. So that would be the big concern of that family.
Thank you. Gary.
So, what I gather is that the main concern is losing benefits. Losing benefits, and also we are not reaching the community in a way that is was working for them necessarily. They give the example of a family who didn't qualify for assistance even though they were able to meet their needs, but they were still
Do meetings like this help people feel more confident?
Sí.
Yes.
Gracias.
Thank you.
A ustedes
And
como
thanks to all of you
American Community Media,
as American Community Media and Tu Tiempo Digital and the people that are providing this information. It's not for us, it's for our community. So they could also coordinate to get this information, obtain it, and to start helping themselves. And I think that these local agencies should be doing things like this to inform more our people, because in their work hours, because maybe they start at 7 o'clock in the morning, they get out at 4 o'clock in the afternoon. People need to go find and to go work. But if they don't know how to go find for that assistance, how are they going to get there? So I think that we need to find a place also so our people could go get close to, like today. We had the community that's here today, and to give us that nutrients of this information, valid information.
Could you summarize?
Yes, so he said yes, this is helpful and thank you. And he said that it's good that we're going to the community and having these events because most of them work from 7 a.m. to 4 p.m. and they're not available during office or business hours, so it's good.
Thank you. I want to ask our panel to address what Francisco said about the information gap. And it's partly a language gap and a gap of time, but how this is the challenge and why we have so many journalists here tonight. We want to help you get the word more broadly, and we want to thank the community members who came, because you are the best informers of your neighbors and your community. But I'd like to ask each of our speakers for a final comment on how we bridge this information gap when there is so much uncertainty. A lot of people don't have computers, don't have access to the internet even, and they're dependent on word of mouth or radio programs like Radio Original and Spanish language media. So yes, please, starting with you, what do we need to do?
I have other concerns as well. As we work with the parents and the families and their hard workers and their agricultural workers. There's women that are pregnant that they don't put them on disability quickly. They need to get them almost at 8 months pregnant. They give them disability. And some, they're exposed to chemicals out at the plants out in the fields. Why can they not get disabled? The doctors disable them at an earlier time in their pregnancy, so the women wouldn't get sick, so their children also, it doesn't affect them when they bear those children. Because in the schools I've been working with, there's many children that have autism now, because also in learning deficit syndrome. And I believe there's something to do with those chemicals that are out there in the fields that they're being exposed to in the fields. Thank you.
Please. I should have had an interpreter just for those of us who don't speak.
I think I'll get extra credit for this one.
Yeah.
So here, I think the concern that he mentioned is that there are some farm workers who are expecting, they're pregnant, and they're working all the way 8, and that's just like a concern that they shouldn't be letting have access to disability benefits.
Yeah, radio digital, right? And then we'll go to finals.
Okay, thank you guys. Two things. In regards to maternity leave, it is my understanding that women working in the agricultural field, they can go on maternity leave once they have a positive pregnancy test. Once they have a positive pregnancy test, they can go right away on maternity leave. So this is what I've heard recently. So can you guys corroborate that if that is true? That women working in the agricultural field, they can go on maternity leave as soon as they have a positive pregnancy test.
Unfortunately, that's probably anybody here on the panel. It's actually the employment department, that another agency that oversees that component.
It is my belief that this is coming from the labor department where I heard this. I don't have the exact provision, but this is something that I recently heard, and this is sad hearing that women that are working, with 8 months pregnancy, So this is very important to share with the community that if this is true what I'm saying, that women can go on maternity leave right away if they're working in the agricultural field. This is awesome that we're doing this because we can learn more about all these resources and information. The second thing that I wanted to mention is about the information gap, the language barrier that Francisco was sharing, that our community, a lot of our community don't know how to read, and the information that they need to be shared with them is in their native language orally. Something that I wanted to share with Francisco is, for example, MyCop. Last year we lost like 80% of our funding for a medical navigators program. Okay, we also suffer budget cuts. And I wanted to ask Francisco if he knows about MyCop in Santa Maria. We have an office in Santa Maria where he can direct the community to our office there. Let me get the address in case he doesn't know or if people don't know. Our address in Santa Maria is 110 South Lincoln, Santa Maria Street. 110 South Lincoln Street in Santa Maria. And the zip code is 93458, Suite 201. The Mixteco community that have a question, they can go to our office and there will be someone that will speak Mixteco to them and can help them with information. I don't know if we have a medical navigators program in Santa Maria. And again, this is about resources. So I know, Michael, we have worked with Cencal in certain projects, and maybe this is an opportunity. We can work together on a navigators program for the community and bridge that gap.
Thank you. Thank you. I think it's come to the end of our program, and we want to have each of you get a last word about what you heard and what we can do to make as better informed, better communication, and all the media in the room. Many thanks for being here tonight and knowing that these are great sources. So let's start. Yingjia, just a minute because we're late. And we want to give people a chance to go to the tables, get the food baskets. Yes.
I'll make it short. So again, just re-emphasizing, the state cannot obviously be everywhere, and unfortunately we cannot make all the information accessible in every single dialect, language, and so we are very reliant upon you word of mouth here to share what I've told you today. Spread the word in your community. Again, Medi-Cal is still here. We're not going anywhere. Changes are coming. We want you to understand what they are. And please be reliant on your community to learn about what they are. And again, I know some of the websites we talked about may not be accessible to you, but again, we have navigators. We're going to be restarting the navigator programs potentially on June and July of this year if the legislature approves the funding for this. So please be reliant on your community. Medi-Cal is still here. Make sure you're returning your Medi-Cal packets, the yellow packets that are coming to you, making sure the county knows where you are. If you're changing your addresses, we want to make sure you're keeping your Medi-Cal.
Thank you. Jordan Jabretsky of the Cencal Medical Plan. Healthcare Plan.
Is this on? There we go. Perfect. This has been such rich conversation, and what I want to say is that if you have a question, call Cencal Health. We might not be able to answer it. We might need to refer you to social services or the DHCS, but we are a no wrong door. We partner with MyCop to offer interpreter services so we can talk to you in your language. We can connect you with community organizations like Family Service Agency. We can help you with enrollment paperwork, with application paperwork. So please, if you have any questions, feel free to start with us. Our phone number and our resources are on the table in the back of the room. We're here to support you.
Thank you. Tonya, did you have the last word on it?
Yo nomás quería también
I just wanted to say, in addition to what Miss Jordan said, is if a member that speaks Mixteco, depending on the language he speaks, could call Cencal Health. We also have an agency of interpreters telephonically for the people that speak Mixteco, because the different variants of them. We speak a little bit, and we give a little bit of information we could get. We have to know from what town, what state, to get the adequate interpreter for them. But we have interpreters, telephonic interpreters, that are available when you call, and so you could communicate with us. All the representatives that answers the lines, there are a total of 15 representatives. 13 of them are bilingual. They speak Spanish. But we could get an interpreter for you guys as well to help.
Thank you. And Michaela Killer-Westall of County Health.
Thanks so much, Cindy, and thank you, everybody. And I also just want to, just echo what Francisco Lozano's concern, but also advice was. I think we at County Health, together with our partners, also with Cencal, we've been working really hard on providing this technical interpretation services. And so I'm really proud to say that currently at the Santa Maria Health Center, we actually have 2 interpreters for Mixteco. We have we have a lot of Mixteco patients also in Lompoc, and we're here to serve the community. And if you don't have coverage, please come to our doors. We have our children's presumptive eligibility, and the enrollment is in real time. You don't need to provide any documentation, because we really don't want you to prevent your children from getting their physicals, their immunizations. That is in real time. So please do, we have a table here. Just give us your contact information, or we give you our number. Just call us, and we can give you all the information for the services. So don't feel like you need to have coverage in order to get your health care. So we really want to work with everybody, especially with the Mixteco population. We do have interpreters.
That's a very important message. And Dario Prodazzi, thank you also for your services for me today.
Thank you. Just very, very quickly, there were some comments about benefits being denied. I just wanted to mention that when benefits are denied, you have the right to request an appeal. so you can appeal a denial of benefits. So when you get a notice of action, in the back of the notice, it will say how to request an appeal. So if you have an agreement with the denial, you can appeal the denial. And also, if your case discontinues because you failed to complete the annual renewal, you have a grace period to be able to complete it without having to reapply. So we always encourage that you try to restate your benefits instead of reapplying for it. Also, the county has a farm worker resource center. So we have a center in the county, social services, that works with the farm worker community. So we invite you to visit and become familiar with those resources. Language should not be a barrier to receive social services benefits. So you should always come into the office and we'll provide interpretive services. That should not be a barrier. And we're always available for outreach. So if you need us to go out and visit with your organization, your community, please reach out, and we're always excited and happy to go out and do this kind of thing.
Thank you. And Francisco, final word.
Buenas noches.
Good evening.
En primer lugar,
First of all,
me siento admirado.
I feel very admirable to be here, to be on a panel like this.
Porque, no sé, el trabajo que estoy
The work
haciendo
that I'm doing
por mi comunidad, yo no tengo organización.
for my community, I don't have any organization, I don't have any resources, but what I'm doing for my community is my heart I'm putting out there. And my heart, I'm taking this work in the community. What I've been able to do and to be here, I feel so pleased. But also this evening, it was also for this evening, it wasn't just the representatives here, not just the media that's here, but it's you guys that came out from the community that made this community a success this evening. Why? Because we have to be and get this information out there, and that's what's going to make a difference in health. There's a lot of things to work on in our community, in Mixteco community. The folks that are in Mixteco, they don't even know what also is going in for first aid kit. When they go first aid, they say, what's your primary care doctor, also your physician? They don't have one. They don't even know what is your physical exam. When's your last physical exam? They don't even know how to answer that. Sometimes they wait till they're sick. Diabetes, cholesterol, thrombosis, aneurysm. Something happens. And that's when someone's already about to die. And that's when they said, okay, now I got sick, but they never went to go get a physical exam. Other cultures do that. I'd like to, in the future, that we can keep on doing these forums with all the representatives, local representatives, so we could inform and help and give education to our community, Mixteco community, and non-Mixteco as well, and other ethnicities or other people in the community. We're a lot of people here in the community in Santa Maria. We're strong together, and thank you. I hope that you guys deserve a big applause for you guys. You guys came to receive this information. And for the ones that didn't come, for the next meeting, please, we're going to invite them out to be here because it's very important. Thank you so much.
Final summary.
So he said that he thanked the community for coming and joining us. He talked about some of the challenges. Individuals in the community don't know what it's like to have a primary care physician or a non-physical, so we should continue with this.
Thank you. I want to ask Claudia for a final word and thank the table, the resource people who came, the people who came with donations of food, but I want to Claudia, mainly thank you for convening such a great gathering. Final words of what can you do in the last?
Gracias, de
Thank
verdad.
you, really, thank you for being here. You guys make this community large. Together, we're strong. United,
Uno mismo,
we're one,
en verdad,
one ourselves. Don't lose your identity. Don't be afraid to speak out, to see what you feel, your concerns. The message that Francisco said was real and true. And all of us know the barriers that our community from Oaxaca and Guerrero face, especially here in Santa Maria. We owe it all to our community. It's the only legacy we're going to leave, and something that we're going to make and do. It's going to inspire someone, as long as it inspires one person, but hopefully more. And Sandy and Peter, that they suggested, they said, Tu Tiempo Digital, we were just getting together some canned goods and some things to give away. Look how something became so big, so large, out of just talking that with them. This is the first time that I've been serving right here. I've never had this lovely panel before, ever. So thank you. We thank them, that they're our local representative, and you guys gave them your questions or doubts. If you have more, please raise your hand. But it's so important that they take away all the information. I see everybody doing their notes, and please, at the end of the day, this needs to be taken out to all the people to make and create changes. We're here for you guys as well. We need you. We need the government agencies, the leadership, Francisco as well. 12 years doing his work out in the community, doing this. And he has a great power. As soon as it gets, he feels every month the Mixteco indigenous people and everywhere. And we'll use Francisco, use each leader like agency. And we'll call, and then we should talk more in Spanish in the videos, right? On videos, not just by text. The Latin community in Oaxaca and Guerrero, they understand more in videos, by watching videos in Spanish and Mixteco. There's a lot of things with us, Digital. We're the only ones that give this service. More people in media and social media should offer this. And other throughout the state, San Francisco, from Los Angeles, from Riverside, from Oxnard, they came. To me, it's an honor, a true honor. I never thought 20 years ago that I'd be speaking right here, speaking Spanish, and being part of this great change. Very important for our community. And it's not a change just for me or for Tiempo Digital or for Francisco. It's for all of us here, for all our community. And the ones that we owe. Our community that works since 3 o'clock in the morning out in the field, with the cold, with the heat, full of mud. We went today to work out in the fields with us today. We went to go take pictures and testimony. And it's admirable work. Many of you guys, I've asked you guys, have you guys ever gone to the fields? The majority of government did not. But they need an hour. Fields are not very far away, right away, just a block away. Give yourselves that opportunity. Share something with them. Take them a lunch and see how beautiful it is to share. So that's the only thing we're going to take away in our lives. So thank you so much. And thank you. Right now, we're going to get the donations out over here. We're going to let them know that thank God that they've given over here with their tickets. And over here, there's also some food. And on the left side over here, Santa Barbara over here, we have some beautiful things over here also with the tabling over here on this side. Please leave with a lot of joy and happiness. That together as a community, we're strong. Please. And that identity makes us unique.
Thank you all.